There's 1, 2, 3, 4, 5.
I'm kind of ready for the sweet one.
Okay, here we go.
Did you know that you have the power in your hands right now to save lives? You don't have to be a doctor or even a nurse. By becoming a registered organ donor, the average American has the potential to save or improve the lives of up to 50 others. According to the Organ Procurement and Transplantation Network, or OPTN, as of October 13th, there were 120,379 Americans listed and waiting for an organ transplant of some type. More people are added to that list every day. As an employee of a large transplant center, I've been lucky enough to learn about organ and tissue donation firsthand. Today, I'd like to tell you about the basic points of organ and tissue donation. I'll explain the need for donors, the process of registering to become an organ and tissue donor, and how donated organs and tissue are allocated to the patients who need them. A patient may require an organ or tissue transplant for several reasons. The 5 major organs that can be transplanted are kidney, paired kidney and pancreas, liver, heart, and lung. According to the frequently asked questions page of the Kentucky Organ Donors Affiliate's website, intestines, cornea, skin, bone marrow, umbilical cord, bone, and peripheral blood stem cells can also be donated for transplant. Complications of diabetes, genetic kidney disorders, alcoholic liver disease, emphysema, abnormally enlarged heart, and coal miner's lung disease are all causes for organ failure. These diseases and conditions affect millions of Americans. In severe cases, medical care and drug therapy are not enough to keep the body functioning without requiring a transplant. So how do these patients receive the new organs they need to stay alive? It wouldn't be possible without the generosity of donor patients and their families. Through organizations such as UNOS, the United Network for Organ Sharing, in cooperation with state and local circuit clerks' offices, registries of donors are created. In Kentucky, the first opportunity to get involved in organ and tissue donation usually comes along with obtaining a driver's license. Most people are presented with a choice when their license is printed as to whether or not they would like to become an organ and tissue donor. What many people don't know, however, is that one doesn't need to sign the back of his license to become a donor. Trust for Life, a nonprofit organization in Kentucky, states on their website that the Kentucky Organ Donor Registry exists online to provide Kentuckians with an easy and accessible way to join the registry from the comfort of their own home. Hi, Dr. Yanagita.
You're good.
We can edit it real quick. It is always a good idea to notify loved ones of the decision to donate so that there's no surprise in the event of the donor's passing. In some cases, the family is even asked to give consent for donation. The idea of giving up ownership of you or your family members' organs can be distressing for some people. Once donation is explained, however, it can actually serve as a comfort to a grieving family or a dying patient. Knowing that the suffering and loss that the donor and donor family are feeling is not in vain can help create a sense of peace. Once the donor has passed away or the decision to withdraw care has been made by the family, the process of allocating, procuring, and placing the donated organs begins. Allocation, or distribution to patients of organs, is based on several factors. Blood and tissue typing must take place and compatibility between donor and recipient must be confirmed. As stated in literature for organdonor.gov, a branch of the U.S. Department of Health and Human Services, medical need, time on the waiting list, and geographical location are all considered when placing organs. When an organ procurement organization is notified of a viable donor organ or tissue and has contacted the recipient or physician of the recipient, the process of getting that patient to the hospital and consented for surgery begins. In some cases, the recipient is already in a hospital, waiting for a transplant that they may not get out alive without. Procuring or taking organ or tissue from a donor is a process that has become